Wells has been a leader on many different levels. The Alliance Physicians Medical Group, the state organization of independent practice associations. He has contributed to the community as a physician, as board members of the hospitals, and at these other levels. He confronted a number of problems that were affecting individual physicians, and he fixed them. He's gone on to lead the state organization of independent practice associations and be a leader on the state level as well.
I started practice in Watsonville, practicing pediatrics in 1975, and I've held a number of positions in Santa Cruz County healthcare since then. We opened the first intensive care nursery in Watsonville in 1984. At that time, that was the first NICU, they call it, between San Jose and Santa Barbara on the coast. Not too long after that, we opened the very first hospital-based human lactation center in Northern California. When I left my practice in Watsonville, after a few years, I became the first medical director of the Alliance, the Medi-Cal Managed Care System, which was brand new in 1995. We saw some things that staggered me. Diabetes was a much more common problem than I had ever realized. We were now looking at every single hospital admission in Medi-Cal in the whole county, and later on in all of Monterey and Santa Cruz counties together. What we found is once a week, somebody with diabetes was going into the hospital with a heart attack or a stroke or losing a foot. So that lit the fire to me that Medi-Cal, a previously obnoxious bureaucracy, could become a conduit to doing things in a public health arena that nobody had ever even tried to do before. And the Pajaro Valley Community Health Trust played a big role in that because we started the Tri-County Diabetes Health Center in September. We will be 18 months into the COVID epidemic, and the county health department created an acute COVID task force to try and respond to the surge. I was appointed lead to that. It was a great honor. And I think one of the things that I brought to that is that I knew pretty much what was under the hood in all three of the hospitals and the three major medical groups, community health centers, ambulance services, skilled nursing facilities. And I got to say in one meeting, I said, all right, starting about 1 minute ago, we're going to have to ditch the competitive language, the snarky backbiting. We've got to ditch the competition and act like our entire county is constructed to deliver coordinated, intelligent healthcare to everybody who lives here. And they did. They rose to the challenge. And to accomplish any of those, it all had to do with bringing people together. It wasn't somebody bringing something from the outside and putting it on our doorstep. So this is an honor that I never expected, because the things that led to this were things that weren't being done in the quest for recognition. It was being done in the quest for accomplishment on a community scale. This is really gratifying. It makes me feel wonderful. It makes me want to call out so many people, not all of whom are still with us, for sharing in this quest to bring better health and better health care to the Watsonville community. So this is an honor I will treasure for a long time. Thank you so much.